my name is Amber Goana, and I would like to welcome you to my Med Talk. This is going to be some of the things I pulled from the CPJE California law exam, and as you can see, it's going to be basically like a little Naplex, and so each video is just going to go over each section that I kind of pulled little things from, and I hope you like it. So for this section, we're going to be going over medications that have an FDA approval for the use in schizophrenia. First up here, we have first generation antipsychotics. These partial 5-HT2A and D2 receptor antagonists, that's going to cause that EPS effect, which is extrapyramidal symptoms. Examples of that is tardive dyskinesia, where you have those jerky movements. It's really affecting your nervous system. We have Parkinsonism, akinesia, is where you're not really able to perform certain functions, and neurolytic malignant syndrome, where you have a really high fever, you have muscle rigidity, and you just have irregular heartbeat. Those are all examples of EPS, which is some side effects you're going to see from these first generations. Also exhibit anticholinergic and alpha-1 adrenergic receptor blocking effects, which is going to cause sedation and orthostasis. You have haloperidol, Haldol, which is actually considered a butyrophorone antipsychotic, and it blocks the central postsynaptic D2 receptors in the metabolic pathway. The dose is 0.5 to 2 milligrams twice to 3 times a day. That's the oral dosing. You can also do 5 to 10 milligrams IV. Haloperidol also comes in an IM dosing, which is 10 to 20 times the oral dosing, and it's going to be given once monthly. It is known to cause QT prolongation, hypotension, and tachycardia. You definitely want to avoid use in Parkinson's disease. Another option we have here is fluphenazine, Prolinux. It's dosed 6 to 12 milligrams a day orally. There's also an IM dosing, and it's kind of going to vary in that dose. It is given every 2 weeks though, IM. We have thiothenexine, Navine. It's 15 to 60 milligrams a day. Next we have triloflurazine, Stelazine, which is 15 to 50 milligrams a day. Loxapine, Loxetane, or adubicine is another name for that. It's 30 to 100 milligrams daily. It is known to cause bronchospasm, so people who have asthma or COPD, it might not be the best option for them. There's fluphenazine, Trifluon. It's 8 to 64 milligrams a day. Thyrazine, Melril. It's 300 to 800 milligrams a day. It is known to cause QT prolongation, just like haloperidol, as well as hypotension and tachycardia. Then we have chlorpromazine, Thorazine. It's 300 to 1,000 milligrams a day. Again, it's also known to cause QT prolongation, hypotension, and tachycardia, just like the Thyrazine and the haloperidol. All of these first generation antipsychotics you really want to avoid use in the elderly with dementia. General side effects of all of these, they cause leukopenia, agranulocytosis, neutropenia, sexual dysfunction, seizures, and ophthalmologic. Next we have second generation antipsychotics, and just like the first generation, they're also going to cause the EPS side effect, where they inhibit D2 and 5-HT2A receptors. However, they actually have a little bit additive effect, where they can cause the release of prolactin as well. They block alpha-1 and H1 receptors, which is going to cause the anticholinergic side effect, hypotension, and sedation. Pretty similar to the first generation. It just adds that prolactin release with the second generation. Some examples of a second generation, you have aripiprazole Abilify. This also is a partial agonist for 5-T1A and D2. So it's an inhibitor of D2, but also a partial agonist. It's 10 to 30 milligrams a daily in the morning. It also has an IM dosing, which kind of varies in strength, but that IM dose is given once monthly. It is known to cause insomnia, hence why it's good to take aripiprazole in the morning. And akinesia, which is just going to give you that restlessness feeling, you're not really able to sit still. It is a 2D6 and 3A4 substrate. There's also lorazepam Latuda. It's 40 to 160 milligrams a day with food. It must be taken with at least 350 kilocalories of food. So you can't be just taking a little snack. You got to make sure the patient is actually eating something to get the proper absorption of Latuda. It is a 3A4 substrate, and it is the safest to use in pregnancy. We have olanzapine Zyprexa, which is 10 to 20 milligrams daily at bedtime. It has the highest risk for EPS symptoms. It does have an injection formulation, but it requires a REMS program. So the patient needs to sign up for the REMS program, and the pharmacy also has to be associated with a REMS program if you want them to be taking olanzapine injection formulation. Because it causes severe sedation, it needs monitoring for 3 hours after it is injected. We also have Symbiex, which is a combination of olanzapine and fluoxetine. Here we also have paliperidone Invega. It's 3 to 12 milligrams daily orally. Paliperidone actually has 2 different brands of IM dosing. There's IM Cystina, and then there's IM Trazina. The Cystina is dosed once monthly, but you want to be taken orally for 4 months, the paliperidone, before you start giving this IM Cystina injection. And then the IM Trazina injection is given once every 3 months. The creatinine clearance, you kind of want to monitor in these patients. If their creatinine clearance is 10 to 50 milliliters per minute, they kind of recommend maxing that dose out at 3 milligrams a day. Once their creatinine clearance gets below 10, they don't recommend using this paliperidone at all. It also has a pretty high risk for EPS side effects and causes irregular periods in females. It's risperidol. It's 4 to 16 milligrams a day orally, but there's also an IM version that's dosed every 2 weeks and injected. It has various dosing strengths that's available sub-Q injection that's given once a month. So the IM is dosed every 2 weeks, but the sub-Q can be dosed once monthly. Doses higher than 6 milligrams of risperidone have a higher chance of seeing EPS side effects. There's quetiapine Seroquel. It's 400 to 800 milligrams a day. The IR formulation is dosed twice a day, where the XR formulations are dosed at bedtime. With that XR version, you want to make sure the patient is taking it on an empty stomach, again at bedtime. It's known to cause ocular and anticholinergic effects, but it actually has no EPS side effects. So it's good to use in patients with Parkinson's disease, quetiapine is. Next we have clonazepam cholesterol. It's 300 to 900 milligrams a day. It's known to cause some seizures. If it's discontinued abruptly, it needs to be tapered off for sure. It's also a part of the REMS program, so the patient needs to be signed up with that as well as the pharmacy, because it causes that severe neutropenia. You want to make sure the patient has an ANC level greater than 1,500 before they start treatment. It is known to cause seizures, myocarditis, which is inflammation of your heart muscle, weight gain, and increased lipids. Ziprasidone Geodon. It's 40 to 160 milligrams twice a day with food. So pretty similar to the lorazepam, you want to be taking ziprasidone with at least a 500 kilocalorie meal. This is an oral dosing. There's also an IM dosing. It's going to be 10 milligrams every 2 hours or 20 milligrams every 4 hours with a max of 40 milligrams a day. It is known to cause QT prolongation and you need to avoid use in patients with heart failure. There's acinapine sulfate. It's 5 to 10 milligrams twice a day. Comes in an SL version tab, so sublingual, and you actually do not want to eat or drink for 10 minutes after you take it. It is known to cause oral hypoesthesia, which is kind of like a numbing feeling in your mouth. You want to avoid use in patients who have liver impairment. Next we have loperidone nap. It's 6 to 12 milligrams twice a day. You want to titrate up slowly because it is known to cause orthostasis. It could lower your blood pressure. Brexpiprazole Rexulti is another name for it. It also experiences some partial agonists of the D2,5-T1A receptors. It's 2 to 4 milligrams daily. It is pretty well known to cause some weight gain. The last option we have here is carbendazole Vylar, and it is also, again, just like the Rexulti, it's a partial D2,5-T1A receptor agonist. It's 1.5 to 6 milligrams daily. All of these second generation antipsychotics cause sedation, QT prolongation, orthostasis, headache, and weight gain. Now, if we want to kind of compare the different antipsychotics together, EPS side effect wise, the highest known causing is your haloperidol and your fluphenazine. The lowest causing thioridazine and chlorpyrazine, and that's actually the same for ranking potency. The highest potency one is haloperidol. The anticholinergic, sedative, and hypotensive effects is flipped. So the highest causing is the thioridazine and the chlorpyrazine, with the lowest causing haloperidol. Looking at the metabolic syndrome side effects, ones that are really going to affect your cardiovascular risks, the clonazepine, olanzapine, and quetiapine have the highest risk, with aripiprazole, ziprasidone, lorazepam, Rexulti, and Vylar have the lowest cause of metabolic syndrome. Looking at sedation and weight gain, your highest causing are thioridazine and chlorpyrazine, clonazepine, and olanzapine, with the lowest aripiprazole, ziprasidone, lorazepam, haloperidol, fluphenazine, and loperidone. Looking at anticholinergic wise, thioridazine and chlorpyrazine, clonazepine, olanzapine, and quetiapine are the highest, and then the lowest are haloperidol and fluphenazine for causing orthostasis, low blood pressure, sedation. The highest are thioridazine and chlorpyrazine, clonazepine, quetiapine, Rexulti, with the lowest being aripiprazole, ziprasidone, haloperidol, fluphenazine, olanzapine, and escapine. Ones that are known to cause an increase in prolactin secretion are haloperidol, fluphenazine, risperidone, and paliperidone, with the lowest being thioridazine and chlorpyrazine, aripiprazole. The highest causing extrapyramidal symptoms, those EPS, haloperidone, fluphenazine, risperidone when you're taking greater than 6 milligrams a day, paliperidone, aripiprazole, and lorazepam. And the lowest causing being thioridazine and chlorpyrazine, clonazepine, and quetiapine. And remember, that is actually the drug of choice for a person with Parkinson's disease. And then for QT prolongation, thorazine actually has a black box warning for that. Chlorpyrazine, haloperidol, ziprasidone, and loperidone all have a pretty high chance of causing QT prolongation. So that is all the medications they had listed with an FDA approval in the treatment for schizophrenia. Again, my name is Amber Gawana, and I wish you all the best of luck in all your studies.